This is Melody Mojica with Home Sweet Home, where we discuss real estate, healthcare, business, and government matters. My guest today is Dr. Jonathan BAKTARI, who is the CEO of E7 Health. Thank you for being here.
Oh, thank you, Melody. Thanks for having me.
You're very welcome. Tell us, what is E7 Health?
Yeah, E7 Health is a healthcare company. We're a preventive health and wellness company, and we specialize in all sorts of healthcare that involve vaccinations, immunizations, and that spans corporate health services, student health services, travel medicine, physicals, and anything that involves vaccinations, as well as other related services.
So why did you get in this field? Tell me a little bit about your background.
Yeah, so originally I practiced pulmonary and critical care medicine. I slowly transitioned into administrative medicine, and I had this opportunity maybe about 9-10 years ago to get involved in this organization, help grow it and expand it, and go into fields that we were sort of on the edge of, but really infiltrate and get involved in corporate medicine, student health, travel medicine, physicals.
So if I was sick, would I come and see you?
Yeah, that's funny because a lot of people think that we do that, but we actually don't do primary care. We don't do urgent care. We don't do any kind of service where it involves people being injured or what have you. And the reason we don't is not because we don't want to, but there's plenty of people that do that. Well, we want to focus on the stuff that's our core strengths, which is what we do in terms of the preventative health and wellness that we do.
What type of patients or individuals should come and see you?
So we get two types. So we get people that are referred to us by institutions, like companies will refer their employees. Schools often refer their students, allied health schools like nursing schools and respiratory therapy and medical schools. And then we get people who are retail people who are traveling, need a physical for immigration, need a physical for sports, or any type of physical that's not involve them being ill, if that makes sense.
Okay. Let's talk about, you said something in the line of immigration. Let's talk about the Asian community, since you're on, on Asian Culture TV. Tell us how this could impact or actually assist the individuals that are Asians.
Yeah, so we provide two very kind of unique services for the Asian community. One, let me just start off with our immigration physicals. Homeland Security requires people to get a very detailed and very specific physical. So 15 pages long. It's not something your primary care doctor can fill out. And it actually has to be done by a doctor who's designated by Homeland Security as a civil surgeon who can perform these. Excuse me. We have those doctors on staff, and we can do those physicals. I think what makes us unique in terms of the immigration physicals is that we actually do all the things that the physical needs besides the physical, meaning vaccines, blood work, laboratory testing, urine testing. We do all that in-house. We're one of the very few places in Las Vegas, and we have an office in Chicago where we actually do everything. So immigration attorneys and sometimes retail clients come to us, and we do that physical to get them ready for their green card. When they go in for their final interview, they have to bring a packet, a sealed packet, with our physical in it.
I didn't know that. I didn't even realize. So is that somebody that's transitioning from a green card holder to an American citizen, or
it's to get their green card? Yes,
it's to get their green card.
Yes.
So when they're already here, maybe it was a fiance visa or any of that. Oh my gosh, that definitely helps. I'm sure there's still a lot of individuals like that fiance visa from different countries. That is very popular.
Or relative, or what have you.
Relatives that come over.
Yeah, or sometimes people have been here for other reasons, work, whatever, somehow they qualified for a green card. So we get a lot of different nationalities and a lot of different ways they got to us.
Okay. What about individuals that, we talked about it earlier, grew up or was born in a different country, have been living here all their lives, and now want to travel back overseas?
Yeah, travel medicine.
Yeah, so tell us about
that's
that.
a really unique thing. So most people aren't aware, but the Center for Disease Control recommends if you're going to any of the really developing nations, and by that I mean Central America, South America, Africa, Asia, and Asia, that you really need to see a travel medicine expert before you leave for two reasons. One, there are certain vaccines and medication that most people have to actually get. These are specific vaccines that you don't get as a child often. They're called travel vaccines that we withhold until you are traveling. And then we also do counseling, food, water, safety, insect precaution, specific to where you're traveling to. So if you're telling us you're going to the Philippines, for example, we'll ask you what island. And we have a database, believe it or not, that the same database that Peace Corps, State Department uses. And it's updated every 24 hours. So we can tell you if there's any major issues in that area and also what to look out for. And then we'll, based on what you're going to be doing, not where you're traveling only, but are you going to be staying at 4-star hotels, or are you going to be staying with relatives? Are you going to be eating out? Based on whatever you're going to be doing, we come up with an action plan to keep you safe and healthy.
That makes sense, because a lot of times where you go, the water may not be safe. We know that.
Right.
Yeah,
you
can pick up malaria, you can pick up so many different things.
So malaria is like transmitted by vaccines. But, I think when people go see their primary care doctor, honestly, that's the first thing they say, just be careful with the water. But the water is the tip of the iceberg.
Is it?
Right. Oh, yeah. So it's all about, what kind of food you eat, where you're going to eat, if you're going to be eating food at the roadside, where people are serving
the street food.
Yeah, because I always tell my patients, when you look at street food, you got to just say, does this person who's selling you that street food, do they have the economic means to keep the stuff in a refrigerator overnight? And you just have to understand the risk and what type of food. We teach patients, for example, no matter what type of food it is, if you cook it and you eat it steaming hot, for example, I'm just giving you a few tidbits, your risk is much, much less than if you eat it cold.
Okay.
So different strategies that we go over, that's with food. Then we do insect precautions, safety precautions, crime, how to avoid trauma. So it's a full consultation. Actually, the Center for Disease Control, if you go on their website, cdc.gov, walks you through that you should really get this kind of consultation before traveling to these countries.
What happens, can you tell us, for someone that travels, maybe you can share with us, if they do travel overseas and they have all these symptoms, not wanting to come back to the United States, what happens in that case? I don't know if someone
it's funny you should say that, because for example, we talk about, for example, traveler's diarrhea, which is one of the more common things that happens to people. So we go how to prevent it, but we also give you a prescription based on the country you're going to, and you don't actually start this prescription, you just take it with you, sort of like just a safety thing.
Yes.
And then if you get the runs, if you get traveler's diarrhea, if you start it, it will lessen the time you'll have it. So one, we help you avoid it, and then we'll, based on CDC guidelines, we'll give you a prescription to take with you, again, for traveler's diarrhea. So that's one of the many things you get in a travel consultation.
Is there anything that you could share for anybody traveling, or we talked about corporate medicine, or what is corporate?
So corporate medicine is really, corporate health as we call it, is really anything that companies and corporations need to keep their employee safe while they're doing their job, or they need to have the medical procedures done to them to fulfill regulatory guidelines. Meaning there's a government agency that says, all your employees need to have their hearing checked every year if you're working in a loud plant, or whatever the industry is. Or if you're working in healthcare, there's, OSHA requires all healthcare workers to get a flu shot every year, a TB skin test, not all, but most. And so corporations have to either comply with regulatory guidelines, or they just want to do it to keep their employees safe. And it also goes to corporate travel. If a company is opening up a branch in the Philippines and they're sending their employees there, they have a certain obligation to keep them safe while they're. So we'll even do travel medicine for corporations if their employees are traveling to certain countries.
That's wonderful. It sounds like a whole scope of service on there. Is there anything that we missed as far as conversations and what you want to share with us?
Well, I think, the big thing that we do for companies, for example, that just expand on the corporate health side, is we actually are an employer health solution. So corporations and companies come to us with an issue or a problem. And often they have 4 or 5 vendors they're using and they're struggling. So they may hire a flu shot company to give their companies flu shots. They may hire another company to do drug testing, to drug test, pre-employment drug testing.
Yes.
They may hire another company to give vaccinations. And so what we do is we take all of those things and we wrap it up into one package. We provide, so one provider provided all of those services. They essentially get one bill from us,
right?
And all their records are in one place.
Yeah.
So it's a real plus for corporations who are struggling to get, these services for their employees from 4 or 5 different vendors. And I think that's what makes E7 Health unique when it comes to corporate health. We basically do anything and everything that a corporation would need to either be compliant with regulatory guidelines or keep their employees healthy.
Wonderful. Let's go back to individuals needing physicals for the immigration status, change of status. I think you mentioned that the physical has to be performed by one of their
civil surgeons.
Yes. And you talked about being sealed, because a lot of people don't realize maybe that they can go to just their own doctor.
Right. We get a lot of that. So when they get that letter from Homeland Security that you need this physical, a lot of people will go to their doctor, and I think it becomes pretty obvious from the doctor's offices they're not on the list to do those. So people come to us, and I think Homeland Security, once we do it, we're actually supposed to seal it before we give it to them.
Okay.
We actually put tape on it, and we put our initials on it so the tape can't be this per Homeland Security guidelines.
Wow.
I think Homeland Security wants, when they show up to their interview with this physical, that nothing's been altered or tampered. So I think it's a safety thing Homeland Security is looking for, that no one's tampered with it since it left the doctor's office. So it's actually a sealed package.
Wonderful.
And
it's a good thing.
Yeah, right. No, I think it's good for everyone. And often we give that to them, and they often give it to their immigration attorney, and that goes with them maybe to the interviews. So it's for people who are doing it, it's a process that they get,
So is an attorney somebody that would be the one to order this for them? Or does the individual, how does that work? How does an individual come to you when they need this physical already done?
Right.
Is it from their attorneys, or before they go to an attorney? What is the process?
Yeah, usually they're involved with an attorney, and I think it's different. I mean, certain attorneys, of course, get to know us, and I think when they realize we're probably not only give great service, but we're one of the very few places that the person gets the vaccines, the blood test, the urine test, everything done in one location. So it's good for the attorneys because they're trying to expedite the process. But then, truthfully, there are a lot of other ones where the attorney just says, go on the USCIS website, and there's a list of all the physicians that can and just find one. But I think as the years have rolled on, more and more people, and then even so the other way of referral is a lot of times families who've gone through it. When they have another family member going, they actually bring them in and say, oh, you have to come here because I did mine and everything went well there. So we do immigration physicals, but actually we do a lot of other physicals too. We do everything from Boy Scout, Girl Scout to North Pole physicals to Saudi Arabia work physicals. There's about, believe it or not, 200-300 different types of physicals that normally primary care doctors are not used to doing, and they don't have the vaccines, the blood work, the hearing tests, vision tests. A lot of these physicals have very specific requirements. Like for the Saudi Arabia work physicals, believe it or not, they want a stool sample for parasites. I mean, these are not physicals that you just go in and the doctor listens to your heart and lungs and signs off on it. They're very detailed. Some want x-rays, and, pretty exotic blood work sometimes. So if you're not used to filling these out,
you can miss something, and it could be detrimental to the individual because they go back, they think they have everything done and it's incomplete, and then they get pushed back again for not completing that. That's a very important part of it.
Right. So I think the fact that we don't do primary care allows us to be really good at all these other physicals and the travel medicine because if we were sneaking in somebody with a cold in between all of this, and the last thing, our technology, we write our own software and technology because there is no technology out there that does exactly what we do. So with us, it's very, very unique because patients, for example, book their appointments online, which I know a lot of doctors have, but even when they leave our office, if we've provided any service for them, it's actually in the cloud on their portal. So by the time they get to the parking lot, whatever we did for them, they could literally go to their phone. And we actually don't even have a medical records department, if you can imagine that, because everything we do for a patient is on their portal, which they can log in on our website and see the records. So I think that's the thing that kind of most people, corporations and retail clients like and patients like.
Absolutely.
Is they have access to everything.
Yeah, immediately.
Yeah.
Dr. BAKTARI, thank you so much for sharing with us. Please tell our audience how they can get a hold of you, especially a lot of our Asian community out there. Please do so.
Sure. Well, you can visit our website. It's e7health.com, or you can email us at info@e7health.com, or call us, and our staff will be more than happy to help you. Our phone number is on the website, e7health.com, and we'll be more than happy to help anyone who calls.
Thank you so much for being here today.
Thanks so much for having me, Melody. Thank you.
You're very welcome.
Okay.
Well, Las Vegas and any immigrants out there or individuals that are coming in, or even for school and work, you have a one-stop shop with E7 Health. Contact Dr. BAKTARI and his group, and they'll be more than happy to help you. This is Melody Mojica with Home Sweet Home. We'll see you next time.